we studied the academic performance of youths with childhood-onset chronic rheumatic diseases, including juvenile arthritis and systemic autoimmune rheumatic diseases. Juvenile arthritis is chronic arthritis in childhood, starting before an individual's 16th birthday. This affects 1 in 1,000 Canadian children and youths. Systemic autoimmune diseases is composed of systemic lupus erythematosus, Sjogren's syndrome, inflammatory myositis, and systemic sclerosis. These conditions are rarer, occurring in 1 in 5,000 Canadian children and youths. They affect multiple organs and not just limited to the joints. As they are ill during childhood, when their main occupation is to be a student, we ask how their academic performance compares to their peers who do not have these diseases. This has been difficult to study to date with conflicting results. Manitoba is unique in that we have one pediatric rheumatology center where all such patients are seen. We have a clinical registry since 1984. We linked the clinical registry of confirmed cases to the provincial administrative databases housed within the Manitoba Population Research Data Repository, allowing us to study this group of patients at a population level. Within this repository, we not only access information about their healthcare use, but also access their education data, family use of employment assistance, and child and family services. This allows us to study the association of childhood-onset chronic rheumatic diseases with their academic performance while considering social demographic and mental health issues that are known to affect school performance. In Manitoba, all grade 12 students need to take 2 standards tests, language and arts and maths, which include different versions according to each individual's capability. We measured their performance using the grade 12 Language and Arts Achievement Index, or LAI, and Math Achievement Index, MAI. These indices were generated based on the marks in the standards test, but also included those who did not take the test for any reason. For instance, they dropped out. These indices move in step with the probability of graduating from high school within the next 4 years. By using these indices, all eligible grade 12 students were studied. Not only those who took the test, which would have been a biased population, but this way we gain a true population-level view of academic performance. In addition, we also looked at age-appropriate grade 12 enrollment by 17 years old. We matched our patients to 5 of their peers without these diseases by age, sex, and residential postal code. In total, there were 541 patients. Our patients had significantly lower LAI and MAI than their peers. 1 in 3 of our patients were not enrolled age-appropriately in grade 12 by 17 years old, compared to 1 in 4 of their peers. This was significantly different. Having a chronic rheumatic disease was independently associated with worse performance in both of the standards tests. After considering factors such as neighborhood socioeconomic status, maternal age at first childbirth, families ever on income assistance, child ever in care, pre-morbid or disease-caused mental health issues. The effect of having a chronic rheumatic disease was on par with some of the social demographic and mental health disorders. Similar effects were seen when we looked at age-appropriate enrollment. Having a chronic rheumatic disease reduced the odds of being enrolled in grade 12 by 42%. This was on par with some of the social demographic factors and having mental health issues in the time between diagnosis and the grade 12 tests. This is the first time such a population-level view of academic performance in Canadian youths with childhood-onset chronic rheumatic diseases is demonstrated. Being able to compare our patients with their matched peers provided much-needed context to understand the impact of having such diseases. We also learned that having these diseases was akin to having some socio-demographic measures of adversity or mental health issues. For the pediatric rheumatologist, knowing the effect of childhood onset chronic rheumatic diseases, especially in the context of each patient's social environment and risk, will allow us to advocate more effectively for our patients with their schools.